Hello everybody, this is Miss Page, and this lecture will cover heart failure. The objectives for this lecture are going to be to identify the etiology and pathophysiology, clinical manifestations, assessment, diagnostic tests, medical management, nursing interventions, and prognosis for patients with heart failure and pulmonary edema, and also specify patient teaching for patients with heart failure. Just a little bit of an overview of heart failure before we get into it. When the heart cannot pump enough blood to sustain the body's metabolic needs, that is called cardiac insufficiency. You might hear this term referred to. You might also hear heart failure referred to as congestive heart failure, and this is when there's heart failure with pulmonary or systemic congestion. And know that 10% of patients diagnosed with heart failure are going to die in the first year, and 50% diagnosed with heart failure are going to die within the first 5 years. There is 4 stages of heart failure, and these are set by the American Heart Association and the American College of Cardiology. So stage A is going to be, they're at a high risk for developing heart failure, but there's not going to be any structural disorder of the heart. So they just have a condition that's going to be strongly associated with heart failure. So hypertension, they have coronary artery disease, diabetes, obesity, family history of heart failure, if they're taking cardiogenic drugs, but they're not going to have any signs and symptoms of heart failure. They're just going to be at a high risk. Stage B is when structural changes have begun. So maybe left ventricular remodeling, the left ventricle is hypertrophying, maybe they have valvular heart disease, maybe they've had a previous MI. But again, there's not going to be any symptoms with stage B. They're just going to have structural changes. Stage C is when signs and symptoms start with the underlying structural disease. So they are going to have shortness of air, fatigue, decreased exercise intolerance. And then stage D is going to be end-stage disease. They're going to have severe symptoms. They are going to require specialized treatment. And then they might be hospitalized, and they cannot be discharged home without symptoms reoccurring. Causes of heart failure, a myocardial infarction. This can damage the heart, so it can make it to where it doesn't pump as effectively. Prolonged hypertension, diabetes, valvular or inflammatory heart disease, infection, stress, hyperthyroidism, anemia, or fluid replacement therapy. Maybe if they're getting too much fluids, that can kind of overload the body, overload the heart, and then it can't work effectively as a pump. So there are different types of heart failure. We're going to cover left ventricular failure, right ventricular failure, and then biventricular failure. Usually you'll just hear it referred to as left heart failure or left-sided heart failure, right-sided. Left ventricular failure is when the left ventricle is the problem. So remember, your left ventricle pumps out all of the blood to the body. So if they have left ventricular failure, then that left ventricle is not pumping out enough blood for the body. It's important to remember the flow of blood through the heart. So we start and it comes in through the blood, deoxygenated blood comes in through the inferior and superior vena cava, goes into the right atrium, then down to the right ventricle, goes to the lungs, that blood gets oxygenated, comes back to the heart, into the left atrium, and then to the left ventricle, and then it gets pushed out. So this blood that's in the left ventricle is not getting pushed out from the left ventricle because it's not pumping enough. So basically it's going to back up into the left atrium and then finally back up into the lungs. So they're going to develop lung congestion. So you can remember left ventricular failure, lungs, left lungs. They're going to have decreased cardiac output because that left ventricle is not supplying blood. So then blood flow is going to decrease to the kidneys and the rest of the body. So their signs and symptoms are going to be related more towards respiratory problems because all of that fluid is backing up into the lungs. So dyspnea, orthopnea, congested cough, crackles in the lungs, blood-tinged sputum, cyanosis. Because there's decreased circulation to the rest of the body, there's decreased circulation to the kidneys, so they might have decreased urine output. Lack of oxygen to the brain because there's not enough circulation, so restless, fatigued. Then you have your right ventricular failure, your right-sided heart failure. This can be caused from left-sided heart failure, so if the left side backs all the way back up into the right side. So over time, the right ventricle is going to have to pump against an increased amount of pressure to kind of compensate for the left side, and that's how it can cause right-sided heart failure. So the blood is going to back up from the right ventricle into the right atrium, then through the superior and inferior vena cava. So that's going to congest the organs. It might seep into the abdominal cavity, causing ascites or ascites, however you want to say it. And then finally it can back up into the tissues, leading to edema. So your signs and symptoms for right-sided is going to relate more to when it backs up in the body. So jugular vein distension, or JVD. Dependent edema, so the feet and the ankles swell when they're sitting up or when their feet are dangling. Pitting edema, distended abdomen, the ascites that I was talking about. Palpable liver, anorexia and nausea, cool and cyanotic extremities because there's so much congestion in those veins. And then orthopnea and cough. And then we also have biventricular failure, and this is when both sides, right and left, are in heart failure. Your assessment of your patient that has heart failure, you want to do subjective and objective. So subjective, dyspnea, orthopnea, nocturnal dyspnea, so they're having problems when they're sleeping at night with their respirations. They might have a cough. All of those are going to signal you to something going on in the lungs, so that might signal you to left-sided heart failure. Fatigue, anxiety, weight gain from fluid retention, edema, all of those are going to signal you to maybe right-sided heart failure. It's backing up into the rest of the body. Objective assessment. So they will probably be in respiratory distress. They'll have edema, they'll have abdominal distension, weight gain, adventitious breath sounds, abnormal heart sounds, activity intolerance, JVD, maybe decreased GFR from the diminished blood flow to the kidneys, cyanosis, confusion, irritability from that oxygen deficit. So you really have to pay attention to the signs and symptoms of your heart failure patients because they might not all have those symptoms. Maybe they just have left-sided heart failure, so they're only really going to have the lung problems. Maybe they have left-sided heart failure, but they're starting to develop right-sided, so they have a little mix of both. So it's not just going to be cookie cutter for signs and symptoms for your heart failure patients. This should be a review for you guys. This is the pitting edema scale, and depending on what your facility uses, it depends. So sometimes they'll have you say 1+ pitting edema, 2+ pitting edema, or they might just say trace, mild, moderate, or severe. So make sure that you know your facility policy on that. You guys need to know this chart. I'm not going to go over it because, again, you should already know this, but there's a picture up at the top. For a visual, there's a chart here that kind of tells you the degree and the response. And also remember that 1 kilogram is 2.2 pounds, and that can equal a gain of 1 liter of fluid, a gain or a loss, depending on which way their weight goes. Diagnostic test for heart failure, so chest x-ray. This is going to reveal any kind of congestion on the lungs, pleural effusion. EKG, going to show any cardiac dysrhythmias that might go along with heart failure. An echocardiogram, this is an ultrasound of the heart. It'll assess the valves and the chambers of the heart. Maybe they need a cardiac cath. This will assess the right and left ventricular function, an exercise stress test to determine their activity tolerance, a MUGA scan. They might have an elevated BUN, blood urea nitrogen, and creatinine. That's from that decreased glomerular filtration rate, from the decrease in blood to the kidneys. Liver function tests. These might be slightly elevated. BNP is a big one. So BNP is a hormone secreted by the heart in response to the ventricular expansion and the pressure overload. So the higher level of BNP is going to correlate with an increase in the patient's signs and symptoms of heart failure. So normal level is going to be less than 100. Greater than 100 suggests heart failure, and greater than 700 is going to indicate decompensated heart failure. Medical management for heart failure. We've talked about a lot of these drugs already. So digoxin. This used to be the cornerstone treatment of heart failure, but now it's used less often, just because of that risk of digitalis toxicity. But basically what this does is it increases the force of contraction of the heart and helps decrease heart rate, so that increases cardiac output. Your vasodilators, nitroglycerin, isosorbide, this increases the efficiency of the heart, decreases afterload, which is that resistance that the heart has to pump over because those arteries are dilated, so it makes it easier to pump through. ACE inhibitors, remember those end in pril. These decrease peripheral vascular resistance and improves cardiac output. This is going to help improve quality of life for heart failure patients. Beta blockers, so carvedilol or metoprolol. These stop the activation of the sympathetic nervous system, which is that fight or flight. So they do the opposite of fight or flight. They decrease the heart rate. That's going to increase the contractility of the heart. These are going to be significant drugs for heart failure because they're really effective at reducing the symptoms of heart failure. Human BNPs, nasiratide. These are going to be used a lot in your acute heart failure patients that are decompensating. It's going to help with the shortness of breath that they're having. Thiazide loop diuretics, it decreases the fluid overall. That helps decrease edema and pulmonary congestion. Morphine, this relieves pain, helps reduce anxiety, and decreases myocardial oxygen demands. And then your inotropic agents, we've talked about this, dobutamine or dopamine. This helps improve renal blood flow. This increases GFR, promotes sodium excretion, helps get rid of the extra fluid on the body. More medical management, oxygen. So this is going to help provide oxygen to tissues if the patient is hypoxic. You also want to make sure to lower oxygen requirements of the body. So raise the head to a 45-degree level. Have the patient sit on the edge of the bed with the arms resting on the overbed table. This is the orthopnic position. This can help them breathe easier. Make sure that you're providing reassurance, explaining everything, providing rest periods in there. Diet, it's going to be sodium restricted because that's going to help limit that edema. Restricted fluid intake, and there are going to be strict I's and O's, and weighing the patient daily. They might also have a biventricular pacemaker. This is basically just going to make sure that the heart is beating effectively. And they might also have the implantable cardioverter defibrillator, and this decreases the risk of sudden death for patients. So if they go into cardiac arrest, it will shock them. Nursing diagnoses for heart failure. So they can have decreased cardiac output related to the decreased strength of heart contractions or decreased ability of the heart to pump effectively. They can also have activity intolerance. That's going to be related to the imbalance between that oxygen supply and demand. So the body is demanding more oxygen and there's not enough supplied oxygen. Also, fluid volume excess. This is going to be a big one with your heart failure patients. It's going to be related to decreased cardiac output, And you need to make sure that you tailor this to specifically your patient, because a patient with left and right-sided heart failure can have fluid volume excess. It just depends on what side they have is where that extra fluid is. So left side, lungs, it's going to have excess fluid in the lungs. They're going to have lung congestion, signs of respiratory problems. Your right-sided heart failure, they're going to have a backup of excess fluid in the body. So they're going to have edema, ascites, anything like that. And then also knowledge deficit can be a nursing diagnosis as well. Nursing interventions. You want to make sure that you're monitoring vital signs. So note signs of respiratory distress or pulmonary edema. Monitor your signs and symptoms of left-sided versus right-sided. You need to know if this patient started with left-sided and now they're moving towards right-sided heart failure. That's important that you know, and you need to tell the doctor. Make sure you're watching their urinary output. Monitor for edema or fluid retention. So elevate the legs, that helps decrease edema. Loop or thiazide diuretics, low sodium diet, and a daily weight, and measuring the abdominal girth, especially if your patient has ascites. Auscultate lung fields. Crackles or wheezing, those can indicate that there's fluid in the lungs. Coughing or complaints of dyspnea, shortness of breath. Promote sleep and comfort. Make sure that they're resting during activity, and they might need some extra pillows when they sleep to help sit them up. And then also monitor their psychosocial aspect. A lot of your patients with heart failure can have some depression, so make sure you're paying attention to that psychosocial aspect of your patient. Last thing we'll talk about is pulmonary edema, also known as acute heart failure. This is life-threatening, and it's often a complication of left-sided heart failure. There is an accumulation of fluid in the lung tissues and the alveoli in the lung. So that fluid from the left ventricle backs up into the left side of the heart and then backs up into the lungs. So basically your patient is drowning in their own secretions. Your assessment, you're going to find frothy blood-tinged sputum, and it's going to be frothy because the air is mixing with the secretions that are in the lungs. So every time they take a deep breath, those secretions are mixing with that air they're breathing in. And bloody from the red blood cells in the alveoli, down at the bottom of the lungs. They'll have shortness of air, gasping for air, increased respirations, crackles and wheezing when you're listening to their lungs, severe anxiety and restlessness because they feel like they can't breathe, they feel like they're drowning, feel like they can't get enough oxygen, tachycardia, pallor or cyanosis. Diagnostic tests are going to focus more on signs and symptoms. You can get a chest x-ray to kind of look at those lungs, see if there's any excess secretions in there. And then also ABGs, or arterial blood gases. This can show respiratory alkalosis or acidosis. Your medical management. So there's medications and there's interventions. Medications, you can give them morphine. This will help decrease anxiety, relax those airways, slow those respirations down, reduce the venous return to the heart so it's not overloaded with all of that venous return coming back, and it'll help dilate those pulmonary vessels. Diuretics help decrease fluid in the lungs, and then vasodilators. This is going to decrease that preload. Interventions, you want to administer oxygen. Probably a non-rebreather. If they're bad enough, they can possibly be intubated. You want to have them sit upright with their legs in the dependent position to decrease that venous return. This is going to help relieve pulmonary congestion and dyspnea. You want to auscultate those lung sounds, provide emotional support, check those vital signs, and have a strict I&O and watch their electrolytes.